Welcome back. Are things that you once considered simple now a task due to chronic neck and back pain? Perhaps you can't even do them at all. Well, stop suffering. Dr. Miller with Total Health Chiropractic has a non-surgical, non-invasive approach that has helped so many, along with Trevor here. Good morning. Thanks so much for being here with us, guys.
My pleasure. Thanks.
Absolutely. Okay, well, let's talk about this pain these people are going through, right? It really has sidelined them.
You know, you just say neck or back pain, that's all you really think about, Leanne, but the problem is when people struggle with these issues for months or even years, not only is it painful, but it limits their ability to live the life that they want. Things that we take for granted become very difficult for them, and that could be just walking any length of time, frequently having to sit down, getting out of bed in the morning first thing can be very painful and difficult, and honestly, for some take hours just to get up and get going for the day. And other times it's more than just neck or back pain, but it can start affecting the nerves that go down the arms or into the legs and cause numbness and tingling in the extremities. It could be shooting electrical pain. Other times they get extreme weakness in the extremities where they can't really use their leg or arm the way that they want. So obviously it can become a very big problem for them in their lives, you know, not just painful.
And some of those medical terms that you throw out there are some of the things they might have because of this, or what, the stenosis?
Sure. So a lot of times when it's, you know, a pain or a problem that's not going away or even getting worse over time, it's due to many degenerative issues of the spine. And many times we find that's caused by degenerative disc disease, where the pads between these vertebrae here start to dry out and then thin down. That will lead to encroachment or pinching of the nerves. You can also see when the discs are healthy, they're very squishy like a shock absorber, but when they're degenerated and dried out, they're very brittle and hard and don't absorb shock. And they're easier to tear when they're brittle and hard and degenerated, and that can lead to a bulging or a herniated disc like you see right here, where that disc literally pushes right out into the nerve. You see arthritis begins to develop, and these are all different conditions that can lead to spinal stenosis, which is narrowing of these nerve openings and lead to a pinched nerve and cause those symptoms that we talked about earlier.
What are these people, maybe Trevor, you can speak to this in a minute, but what are these people turning to for treatment normally before they see you?
What we find is that a lot of times they go the medical route, and it'll be different combinations of drugs or medications. Those are just things to mask the pain or chemically relax the muscles. If that's not getting the results they're looking for, a lot of times they'll start going to physical therapy, maybe go to pain clinics for injections into their neck or back. Worst case scenario, many of them are facing neck or back surgery. And you know, these treatments all revolve around symptom relief. They're not usually really fixing the cause or helping the spine get healthier, and that's the reason they have to keep doing those treatments over and over again and not really getting an answer. They're just masking symptoms with those treatments. And
before we get to the DRX, real quick, I want to talk with Trevor to talk about what were you going through before you came to see Dr. Miller?
I get out of bed in the morning, just painful. I would do my outdoor activities, but never looked forward to them. It was always just a daunting task.
Yeah.
So now I actually look forward to getting back outside.
What was going on? We're going to go ahead and take a look at some of the x-rays of your spine to kind of talk about what was going on in there. What did Dr. Miller say was happening to your spine?
Just compression of the discs, and over years of just abusing myself mostly and not taking care of myself.
Yeah, and you probably hear that a lot, don't you, Dr. Miller? There wasn't really just one thing that pushed him over the edge. It was just kind of everything kind of piling up.
Yeah, building up over time. And these are Trevor's x-rays. The first one showed his neck. This is showing his lower back. But we have green arrows showing those openings for the nerves. And those were a pretty decent size for him. But down at the very bottom with the red arrow at his L5 disc level, pretty bad stenosis there, and that disc was quite degenerated and thin. Similar issues in his neck. So, you know, we checked him out and found out what the cause of his pain was, and then was able to offer him our DRX program. And he just finished that part of the program last week, and you know, he can speak for how he feels.
Yeah, let's talk about that. So we're going to look at the video, but talk about this DRX and what you went through.
It is not invasive at all, and there's no. All you can feel is more relief every time.
It's stretching you out, right?
And at night, you just feel more relief, and it's easier to get out of bed. And yes.
You went so long. Here, the answer was that Dr. Miller, and you went all these years and felt so horrible. And
Yes.
then you went to how many times, or how many months or weeks?
We've
or?
been here about 5 weeks so far.
Yeah, about 5 weeks.
Wow, and then already you're feeling better. For you to sit on this couch like this,
Yes.
was something like this painful for you back in the
Yes.
day, walking to get in here, those types of things?
Yes.
Yeah.
Yeah, it's fine now. Yeah, I'm
Great.
looking forward to doing a lot more things.
And you're young. And you see people of all ages, don't you, Dr. Miller?
We do.
You know?
I mean, the fact is these are degenerative conditions of the spine that are usually years of neglect and stress, but we have people that have been in accidents too, and younger people that might be 18 years old. So we've treated, I think, about 17 years old up to a 99-year-old. It's non-invasive. It's a very gentle but specific stretch. It's not pulling people apart aggressively. It's usually more of a relaxing, gentle pull, but with the aid of computers, it actually reverses these conditions I talked about and helps to regenerate the discs, draw those herniations back in off the nerves. And, it's just providing great, long-lasting relief because, we're moving the spine this way instead of going that way. And by getting the spine healthier, they're able to live a normal life again.
All right, well, you have an upcoming seminar. We want to tell everybody at home.
We do.
this?
A lot of these technologies we offer are new and people haven't heard of them. And a lot of times people struggling don't really know what their problem is or didn't really understand what is a degenerated disc or a bulging disc. So November 19th at our office at 6 p.m., I'll be holding a free chronic neck and back pain seminar. You do have to call and schedule because we have limited seating. You're able to bring a friend or a guest if you would like, but that does fill up quick. So if you're interested in learning more about these conditions and possible solutions, call and schedule that. But if you're somebody that just can't wait or you just want relief as soon as possible, we also have a great offer. If they call our office today, they can schedule a $49 consultation and an examination so we can actually confirm what their problem is and see if they also qualify for a decompression program and maybe get the relief like Trevor got.
Absolutely. I'm glad to see you're doing so well.
Thank you.
Yeah, absolutely. Thanks so much for stopping by. Once again,
pleasure.
keep calling there. They're 616-828-0861.